Hello, good evening, and thank you for joining us here on blackdoctor.org. We are excited to have this conversation, and it's one of many conversations that we're going to have all about your eye health and your vision health. And so we want to thank our many, many partners that are along, and I will mention those partners throughout the program. But as you can see, the logo, we are partnering with the Children's Vision Equity Alliance, the National Eye Institute, and many, many others to bring you this conversation. And we're going to be talking about eye health and healthy vision at least once a month throughout the rest of the year. So we're looking forward to those conversations with you today. So today we have an exciting program. But before we get started to the program, there's a couple of housekeeping things I want to bring your attention. Number one, drop in the comments where you're watching us from. We love to see where people are watching us from all over the country. So make sure you drop that in the comment section, and we'd like to give your city a shout out. Number two, if you know somebody that needs this information, please share this on your page, tag a friend, bring them in, bring them into this conversation and say, hey, I'm watching a great program. You might want to get on this right now. And number three, if you have any questions for our specialists here this evening, please drop those in the comments as well, and we will get your questions asked and answered within the time that we have allotted for this discussion this evening. So that's it. 1, 2, 3. Off it. Now we're here, ready to go. Thank you again for joining us. So I'm here with two wonderful specialists in eye health. And so we're going to talk about their individual specialties, where they're related, and why you should be seeing both of them. So we're going to talk about why you should be seeing both of them in their own unique way. So with no further ado, I'm going to introduce Dr. Renee Bevel. And she is, and I said, I did the whole thing, and I asked you, it's Bovell, sorry, Dr. Renee Bovell. And she is an ophthalmologist, okay? And then we have Dr. Tamara Hill Bennett. We're going to call her Dr. T, and she is an optometrist, all right? And so, as you can see, this program is called Seeing Eye to Eye. And so we're going to jump out with the first question for you, Dr. Bovell. What is an ophthalmologist?
An ophthalmologist is a physician that has gone to college, then medical school, and then an internship, and then a residency where we focus solely on the eyes. But we have the broad background of understanding the entire human body. During our residency, we are taught to do surgery so that we can diagnose, treat eye disease, and our goal is to preserve, protect, and restore vision by all means available.
All right. I love it. And so, same question for you, Dr. T. But I'm going to ask you, what is optometry?
Optometry is big. I always try to break it down real simple. There are 3 O's: ophthalmology, optometry, and opticians, right? And so those are the 3 O's. We don't have an optician on here today. We do have an ophthalmologist. And so as an optometrist, I liken ourselves to be your primary care physicians for your eyes. Basically, you come to us for all of your eye care needs. And if we need to refer you out for any specialty work like surgery, glaucoma follow-ups, all that good stuff, then we refer you out to those specialists. So that's what I do.
Okay.
I like that, Dr. T. The O's definitely have it. And, what we enjoy working together in, a comprehensive team. And so whenever we're needed in one or the other, we can all work together. So
Yep, that's it. That's been my goal since I graduated. It's always really put that in, because I think a lot of times, I'm known here as the eyeglass lady, and I was like, well, I do have doctor in front of my name. I had to get used to that for a minute, but I was like, yeah, I do have doctor in front of my name, but I think it's just really educating our communities about the differences between the 3 and how we work together.
I think that it's an important point. So we're going to kind of hang there for a minute as people are joining us. I see we got folks from Villa Rica. That's right here out of Atlanta. Mississippi, hot Mississippi. So we got folks from Mississippi joining us. So keep dropping where you're from, and we'll give your city or your area a shout out as long as I can read it. So that's going to be one of my many, many eye jokes that I had this evening. So I'll have my.
Keep them coming, Ellis. Keep them
Yes.
coming.
I'm a dad. So I'm gonna have some. I'm gonna have some dad jokes. Some bad dad eye jokes coming all night. So yeah. So South Carolina, Indianapolis, Indiana, Florida, all of that. Thank you all for checking in. Appreciate that. So let's stay right there because as an end user, um, I was going to see the optometrist, right? And when I started, when I wanted to get my eyes checked and started to have some difficulty reading and said, oh, I might probably need some reading glasses. My eyes are getting tired. Things are getting a little fuzzy. So I said, hey, let me go see the eye doctor, right? And I didn't know that there were three different O's, right? I just knew there was an O. And so I went to a place where I won't name, but one of those, glasses stores where they've got the eye doctor in the back, and got my eyes checked, got a prescription for my reading glasses, and I was on my merry way. Then I had the sales rep, sell me some glasses, and I was gone. I came back and picked them up a couple weeks later. So, and I thought it was good, but I see, another bad joke there. I see that there is a difference. So, Dr. Renee, when should I see you versus seeing Dr. T?
Sure. Well, because I've gone to medical school and did a residency, so we treat both medical and surgical ophthalmic conditions. I would say one thing I want to hit home with Africans and African Americans, we are at risk, highly at risk for glaucoma. And the thing is, sometimes you may not even be aware. We say glaucoma can steal your vision like a thief in the night. So if you have diabetes, if you have high blood pressure, I've diagnosed people with actually strokes in the eye. I have seen tumors, brain tumors that can manifest in the eye, all kind of things. So I would say at least by age 40, sort of like getting that first good initial thorough checkup. And as I said, we work collaboratively, but the way I like to think of it is sort of like a pilot. In order to get the plane off the ground, you need everybody. The pilot cannot do it by himself. The pilot may say, okay, this is, I'm going to fly the plane, but the pilot cannot do it by himself. But I don't know what happened past 4th of July, with everybody being on strike and some people got stuck. But I would say certainly by age 40, if you have diabetes, certainly earlier. And anytime you have any kind of variation in vision, that's not I need glasses, I can put glasses on and I can see better, but you definitely need to be examined whenever you notice a difference in your vision, or if you have a persistent red eye, or if you have discharge from the eye. And I'm sure Dr. T has seen many patients with contact lens issues.
Yeah.
Right?
Yeah.
If you want to speak to that a little bit.
Yeah. And to piggyback off of what Dr. Renee said, I would also like to educate our community and let them know that ask the optometrist, ask the ophthalmologist, right? Because we're in here for you all, right? Especially as African American physicians. So I consider myself an optometric physician. So when we're in this, we're in it to make sure that you are healthy, right? So ask what their specialty is. Like the range that we are in within the medical field is vast. So it's a range. So I take care of pediatrics all the way to geriatrics, and my specialty is pediatrics and geriatrics. So I get the glaucoma, I get the cataracts, I get the blepharitis, I get the chalazions, all that stuff like that, and I can pick that up. And then because of my network of ophthalmologists that I work with and my relationship with them, literally I can get patients in like that, especially if their pressures are elevated or I've had them on glaucoma regimens for a while, and it seems like their pressures are spiking. I can get them in really, really fast. So you want an optometrist that really kind of does more of the specialty, especially within our African American community. That's what I pride myself on, is really making sure that we're educating the community about ocular health and ocular disease. And then the glasses do come secondary. And I always say, when in doubt, check it out. So if you see an ophthalmologist,
like that.
Really, like literally, I usually get patients where they're like, "Oh, I was seeing fine, and then I was out in the in doing the lawn, and then I went like this, and then I went like this."
Yes,
Okay, well, yeah, you went like
that
that.
means
Oh, the
something.
last time you had your eyes checked, 10 years ago. Okay, well, yeah, now you have a cataract in that eye. You just didn't realize. So or something a little worse. So I love diabetic retinopathy. My beginning years in optometry, after graduating optometry school, I worked in the prison, so I got a chance to see. That's where I fell in love with ocular disease, because I got a chance to see emergencies. I had a chance to see HIV, retinitis, all that good stuff. I loved all that funky stuff. I call it funky stuff. But, and that's why I said, when, just to piggyback off of what Dr. Renee says, ask what their specialty is, because as Mr. Ellis said, he went into the chain or corporate locations. They're specifically for routine eye care. They may pick up on stuff, but they may not actually do a comprehensive eye evaluation, as Dr. Renee was saying, in which we should be getting annually. A lot of times the insurances dictate, especially in our communities, how we should get our eye exam. If you have diabetes, if you have high blood pressure, if you have any ailments, even dry eye, you can get an eye exam every year.
And often, many patients may not be aware of what kind of problems that they're having. So if you have autoimmune disease, such as Sjogren's syndrome or lupus, which we're now becoming more aware how prevalent that is in our community, all of those can affect the eyes. If you have Crohn's disease,
Yes.
any kind of autoimmune, any kind of itis, and itis means inflammation, like arthritis, that can affect your eyes as well, especially rheumatoid arthritis. So we'd like to see that. So if you're noticing maybe a sharp twinge in your eye, oh, my eye hurts, or, we've all been wearing the masks and being on our computers and doing Zoom. So we're seeing a lot more problems with eyes now. We're seeing a lot more dry eye,
Yes.
which means that your eyes aren't making the proper kind of tears. We're seeing a lot more blepharitis, which is inflammation around the glands around your eyelashes, and even what some people call styes or stars. We call them chalazions. Yes. But anything like that, you should feel free to come in. And I love what Dr. T said. When in doubt, check it out. I think we all have the dad jokes today.
I just like to, that's just my personality. It's like, come on,
Mhm.
let's just really try to. I mean, we could talk medical terms all day, right? We can talk and we can put it out, especially within the fields that with how long we've been in the practice, right? But at the end of the day, how do we break it down to our community for them to better understand,
Right.
especially with the fact that a lot of them are afraid to even come to doctors, right?
And
Um, Go ahead.
go ahead. That's what I was going to say. If you find someone like Dr. T or someone like me, we are generally really interested in learning about you, your habits, what's going on with your eyes. And I think I can speak for Dr. T by saying we would much rather have you come in early and we say, oh, that's nothing. It was just an eyelash or something,
Right,
rather than have you wait and you come in a week or 2 weeks later and we see, oh gosh, you have a corneal ulcer
right.
or you have this vision threatening issue. We don't mind. We will much rather have you come in earlier and it's something easy and it can be taken care of rather than having you wait and then it's something much more serious and difficult. So do not be afraid.
Okay, so I've been doing a series on diabetic retinopathy with Dr. Coney. And we've done a couple programs. So I've learned enough to be dangerous. So y'all correct me
Uh-oh.
when I'm wrong. So one thing that I learned is that the eye has 9 different disciplines in medical school that you can choose to be part of because that's how complex the eye is. And then we talked about the dangers of diabetic retinopathy and how the eye it tries to correct itself and creates other vessels when you start having vision problems. But those new vessels can leak and shred, and then they could become problematic and start impacting our vision. And so that's why um, you should get an eye exam, particularly if you have diabetes. You should be getting an eye exam from an ophthalmologist at least on a yearly basis to make sure that you're getting that checked out. So and there was one more thing that I knew I was supposed to give, but it slipped my mind. But the question I would have for you, Dr. Renee, is can you kind of break down give us kind of tell us what the eye is made of, like the construct, so we know what we see, because we hear things like retina and cornea and iris and all of these different things, and I don't know what it is. All I know is I got that little hole in the middle of my eye. I know I got a retina, and I know I watch a lot of sports. I know about when a boxer gets a detached retina, but I don't know
Yes.
what it's for. So kind of just break down the anatomy of an eye so we can get an understanding. And then when we start talking about some of the medical conditions, maybe once we've got that anatomy broken down, then we can start understanding where glaucoma is a problem, where cataracts are a problem, what part of the eye it's impacting, so we can really understand when we're having vision issues, what part of the eye is being impacted.
Well, Ellis, I think that's a perfect question. That's exactly how we learn in medical school. We start off with the anatomy because you got to know what you're talking about, right?
Right.
So that is perfect. So, as you mentioned, the eye is about the size of a golf ball and it sits in the orbit, which is sort of shaped like a softball, maybe around, not a softball, a shot glass. And a little bit different than a softball, and sits in the orbit. So you have the eyeball, hoping you can kind of see, and the eyeball is surrounded by muscles. So there's a muscle here, there's a muscle this way, there's a muscle this way and this way, and these muscles pull the eye up, down, left, and right. And there are other muscles that rotate the eye, but basically those are the muscles. And when you look at the eye, you see the white part of the eye, the white outer shell. That is called the sclera. And that is made of fibrous connective tissue. And it's pretty strong. Now, when you look at the eye, you see the cornea. The cornea is actually what you touch when you put on your contact lenses. People who wear contacts, they're actually touching the cornea. And the cornea is the window. You can look at my eyes, and if I were to touch my eyes right here on the brown part, I'd be touching the cornea. The white part is the sclera. On top of the sclera is a thin piece of translucent tissue called the conjunctiva. It's almost like saran wrap, but it has blood vessels running through it. I'm just letting you absorb that for a minute. Now,
Wow.
on behind the cornea is the iris. The iris is what makes the eye blue, green, brown, hazel, light brown, all the various colors. Okay. And in people with lighter irises, or we call them irides, lighter irises, there's a hole that you can see that looks black. That hole is called the pupil. So sometimes I hear people saying, "Oh, I'm touching my pupil," or "Oh, I got something on my pupil." No, you didn't. You got something more likely than not on your cornea, because the pupil is just a hole.
Okay.
And then behind the pupil is the lens. The lens is generally clear. And as time passes, because we don't use the word age in my office. I don't know about you, Dr. T, but I don't like that word.
You will get beat up. Yeah.
As time passes, that lens gets hazy. Sometimes it can become brunescent, almost like the color of amber, or sometimes it can become white. That is the cataract. So the cataract is nothing that you scrape off. Behind, and the lens allows you, you have your little kids who can read up close like this.
Mhm.
I can't do that. That's because their lens is so flexible and pliable, it can almost get almost like a ball. And then as time passes, instead of going like that into a ball, maybe it can only go that much to help you focus. And then
Mm.
eventually it can go that much, and eventually not, not too much at all. Behind that is the retina.
Oh,
And the
wow.
retina is like layers of lasagna that are attached to that sclera, the ball. So all here is the retina, and in the middle of it is the optic nerve. What is the optic nerve? Well, we've all seen skeletons, and when you see the skeleton and you see the eyeball, and then there's that stalk that connects the eyeball to the brain, that's the optic nerve. And that optic nerve is very sensitive to pressure, and we have to be very careful in glaucoma.
Wow. That, and like, I was
It's
like,
a
well,
lot.
it is a lot. I'm like, I'm waiting for the retina, and you just went through four different layers before we get to the retina.
Yes, yes. And
Okay.
that's why there are so many different specialties. And I tell my patients and my friends, you know, we are so lucky to be living in this age right now, because we have the most medical knowledge, not just in eyes, but in our whole body. We have the best medical knowledge that we have, and we can do so much to help you and to preserve and protect and restore your vision. And there's so much research going on. And I know I'm going off on a tangent. Dr. T, just give me just a minute.
Go ahead. Go
I,
ahead.
okay, I just want to let the audience know, please don't be afraid to come to see us. Please, we want to help you. And we want to help everybody. But when I see somebody that looks like you, Ellis, you remind me of my cousin. And Dr. T, if I saw somebody look like you remind me of my cousins and things like that. So we have an affinity, right? Because we see our friends, we see our families. Actually, Dr. T, you remind me of one of my best friends. And And so we see you there. I got a
Yes.
dad
All right,
joke
there it
in
is. We got
Yes.
it.
See, there you go,
We got
Dr. Renee.
it. We see you.
We see you.
Yes.
I do see a question here. Um, and I want to piggyback off of, I think I kind of went on a tangent a little bit about contact lenses.
Mhm.
So yeah, contact lenses, a lot of people don't realize it's a medical device, y'all. It's a medical device, and y'all can't
Yes.
share these things. That we measure them for your eyes
Mhm.
specifically, even if there's no prescription in them. They are measured for your cornea. They're measured for you. Think of your cornea as a fingerprint, right? We all have distinctive fingerprints. So you want to be sure that that contact lens is fitting properly. It's getting enough wet moisture in between there, and you're being followed by an eye care professional. And if you hear anything from me, even if you hear any of my lives, and Dr. Renee, I don't go between ophthalmology and optometry. I say eye care professionals because I believe that we are all in this together. And so it is important for us to understand that also, if you are a contact lens patient, I'm a stickler for my contact lens patients to have a backup pair of eyeglasses. I don't care if they're 2 years old, 3 years old, if the frame is 100 years old, just get another pair of lenses put in so that, because of the just in case. I think I was in the emergency room when I was at the Pennsylvania College of Optometry, and a young lady came in, was cleaning her bathroom and had a chemical splash in her eye. Contact lens, had to kind of pull that off. But I failed to take her contact lens, and she put the same contact lens back
Mhm.
on. So her cornea didn't look any better the next day. And I was like, wow, what is going on? So I threw them away. They were specialty contact lenses. So as I looked through her chart, which is probably about this thick, there were no prescription in for glasses, y'all. And
Mhm.
so and that was that week I did my case study on her, because I felt as though, and that was the time when optometry was moving into contact lens, moving into all of the medical stuff a little bit more. And I said, what are we doing as eye care professionals if we're not really educating our patients about especially our contact lenses, specialty contact lens? I think her prescription was, like, I still remember, it's probably about a -15.
Mm.
So yeah, and then as soon as I threw them away, she was crying in my chair, and I was like, "Why are you crying?" She said, "I can't see. I'm just getting off of welfare. I'm just getting my life back, and now I
Mhm.
can't see." And so that did it for me. I was crying with her,
Mhm.
and really, took her down to the optical, and it's like, I don't understand why there isn't a prescription for glasses in here. So let me just do your prescription for glasses. Let's try to get this done as soon as possible so we can get you on your feet. But I can't let you put those same bleach contact lenses on your eye. We just can't. And so, because they were specialty made, it would take a little longer for her to get the contact lenses again. So she was kind of like in a rock and a hard place. So
Mhm.
again, we're here for you. Especially as I can say, from my experience, a lot of the African American doctors in our community are really vetted within the community, of making sure that we educate our community. And one of the things that I love is insurance. It says Lauraville NECOP says Medicare does not pay for routine eye exams. Many are on it. It will get their eyes checked due. There is supposed to be a bill being passed. I believe the bill was passed. I don't remember the bill name, but they're working toward it. However, there are plans out there, discount plans that you can have, and Medicare. If they're a Medicare provider, they will give you, there is a discount on the actual eye exam. So instead of you paying 100%, you might be paying 40%, and because that's a discount. So don't I'm trying to say, don't let insurance dictate your health. That's the
Excellent.
best way I can say that.
Yes.
Right.
And also, um, you know, for me as an ophthalmologist, I take your medical insurance, because if you have diabetes, if you have glaucoma, if you have any medical condition, it is covered under your medical insurance. Just like when you go to your primary care doctor and they check your blood pressure or check your temperature and things like that. And one thing I wanted to uh, mention, Dr. T, going back to the contact lenses. Oh my gosh, what do you do when you go in the beauty supply store and you know what I'm going to say, and you see the contact lenses for sale?
There's no
Because you
regulation.
said they're medical devices.
There's no regular. I've been seeing that for years. They even
Ah,
got them at the poppy stores. I'm like, eh, there's no regulation. The only regulation now is really with the 1-800. Well, we can't say it. The the online,
Right. Right.
online stuff.
Right.
Those are being regulated a little bit more. But folks, if I can't tell y'all, if Dr. Renee and I can't tell you enough, at least just get your eyes checked to make sure. I literally had another patient. These are some of the memories. I guess that's why it kind of pushed me toward medical, right? Because, and not just glasses. But there was this sharp lady, beautiful lady coming in, and her daughter will always bring her in. And I happened to work the glaucoma clinic that day, and I saw her, and I was like, well, what happened? She was doing what you just said. She was going to the beauty parlor, getting the gray colored contacts. She wasn't going. She said she wasn't having any problem seeing. So why would she go to an eye doctor? Well, just as Dr. Renee has pointed out, glaucoma can snatch your vision without you even knowing it. And that's what happened. She had glaucoma for years, and it just snatched her vision.
Tragic. And please, I have to reiterate, contact lenses or medical devices, don't spend $2 for something you're going to put on your eye and no one has checked. You don't know if those are expired. You don't know what they're made of. You don't know if they're fit for your eyes. So please, no beauty supply contact lenses. I have seen several patients throughout my career actually lose their vision in that eye because of it. And these types of corneal ulcers, they progress rapidly, like within hours. So please, 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 no beauty.
So if you're just joining us, we are here with Dr. Renee, Dr. T. We're talking about ophthalmology, optometry, and all the O's that are associated with eye health. And so we understand that this is not individual professions, but this is a team, and this is all about your vision health. And so we're going to be continuing. This is our ongoing series throughout the rest of this year about our health, because we talk about a lot of different things here on blackdoctor.org. And we're understanding that, as Dr. Renee told us earlier, and that we've been learning along the way, is that we can see other medical conditions through the eyes. So if you've had a stroke, if you got diabetes, sometimes they can see it before it's actually happened, because what your eyes will start, like I said earlier, your eyes create separate pathways to keep your vision going, right? And so that is to the trained eye, there's another joke there, to the trained eye, they see your eyes are already creating other pathways. That means there's a problem. Yeah. You may not know they're creating other pathways because you haven't had experienced vision problems as of yet. But because they can look in and do that dilation, and that's part of that eye exam, they can see those problems and hopefully catch them ahead of time. But you've got to go in to be able to, and have the exam in order to be able to catch those problems and connect it to potentially other problems that you're having with your health that you may not know at this point in time, particularly those people that might be pre-diabetic in that neutral range, that we don't know we're diabetic, or we don't know where our blood sugar is high, but it's having an impact on our health and it's eroding our health, including our vision. So, Dr. T, I know this, we're going to go into an area where you don't want to get into, because I love the fact that you're more on the healthy side, but we got to get, we're here, we got to get our audience all some information that they can use. All right. So what are those signs that a person might need glasses or contact lens? What are some of those early signs?
As we were talking, this is, eye safety month, and this is also kind of children's vision month as well. We're leading into that. So the earlier we get our eyes checked, the better. So I would even say it even starts as early as we're children, right? Making sure that our kids are getting their eyes examined before they enter the classroom, making sure that they don't have nearsightedness where they see better up close than they do far away, or if they're having difficulty with reading, it could be a sign of what we call hyperopia or some astigmatism. So the earlier the detection, the better. What a lot of people don't realize also, in certain institutions, we can see kids as early as 6 months just to rule out any what we call refractive error. And that is, as Dr. Renee was saying, one of the things about how the eye is shaped. So if you are nearsighted, your eye is a little bit longer, and so the image, if you think of it, the image, if this is your retina, the image stops a little bit in front of it. So what the glasses do is it helps to bring that image to the retina versus a hyperope, your eye is a little shorter, so your image stops behind the retina, and then we use the glasses to put that on the retina. And as far as astigmatism, you probably have heard where your cornea is shaped like a football, and that is that there's, I call it hills and valleys, or peaks and valleys in your cornea, and then we have to identify where that is, so that we can make the image with lenses straighter. And so with that, again, the earlier the better. I think we've all said it tonight. The earlier the better. For contact lenses, I recommend starting if you have children and they're going into the preteen or teenage years. You may want to consider getting them contact lenses. Now, I do talk with my families to make sure that the kids are doing what they're supposed to be doing. That are they responsible? Because it's a change of lifestyle when you go into contact lenses, and it's not just like we talked about before, that contact lenses are considered a medical device. So we want to be clear and exact with the patients that this is for at least a teenager or preteen, that they have to be responsible. They have to take care of them. They can't share them. They can't use saliva to clean them and things of that nature. I had to go there. I'm sorry. I'm sorry. I had to go there. But the earlier, the better. And then we talk about our seasoned saints as we hit our 40s. That's when we might start needing reading glasses. If we call it tromboning, where you're taking something where you're reading, you're like, okay, I can't really see this, but your arms are too not long enough for you to be able to see it. So, oops, my light just went out. So you definitely want to be able to get those reading glasses or bifocal. So there's a plethora of lenses that you get that are out there, but that's just the short of it.
Look, you got me. I'm about to go off on a tangent because I'm like, because I was really about to ask you, why is it when you go to these nice restaurants and they want to have the light so dim and the menus with the font so small? I'm like, I'm a grown man. Why you got it on 8 font on the menu? I can't see none of that. And you got me sitting here in candlelight trying to
That's
read.
why they got the light on the phone, and now they've even got the magnifier on your phone so you can see
Look,
it. But
I'm
what's
getting
helpful?
clown. I don't care. I got the phone light up like I'm sorry. Okay.
No, but to your point, right? So we're talking about glasses, and we're getting into all this computer work, and because of COVID, everybody's been going on Zoom and being, especially the kids and even adults, so we're on there. I find now, although I have bifocals, and as an eye care professional, I'm not sure about you, Renee, I have glasses all over the place, but these are strictly my readers, but they're prescription readers, and they actually kind of work better for me, especially when I'm doing long hours, on the computer, in which you should be taking, thank you, Starlet, we should be taking every 20 minutes on the computer, take 20 seconds to look 20 feet away. I know during the pandemic, when I was telling some of my patients and even the kids, educating their parents to tell them, hey, kind of look away. I know they're in school all day, but no study has been done, at least not to my knowledge. But even with that 20-20-20 rule, that's how we call it. Number one, it allows you to blink and that tear film going. And two, for what parents were telling me was it was allowing the kid to refocus
Mm-hmm.
even in class.
Yes.
So I was like, well, maybe that's something we need to be doing a study on too, is on that 20-20 rule. How is that how can we do that to kind of help a child that may be having some attention deficit disorder to be able to kind of refocus? So yeah.
So say that again for our people, the 20-20-20 rule. So I want everybody to get this completely. So for
Every 20 minutes on the computer. So if you've seen me, I've been looking away, right? Every 20 minutes, take 20 seconds to look 20 feet away. And that will help to not adjust your focus, because we're up here all the time when you're on the computer, or even if you like to read a lot too. The same thing. You look 20 feet away to kind of blink and get that tear film going, and getting your reset button for your eyes.
That is excellent. We have a couple of questions coming from our viewers. So that means y'all are really doing a great job, because they got some great questions here. So it says, is it good to consider having eye washes on occasion?
Well, I've heard of people putting all kind of things in their eyes,
Boric acid.
from honey to even cayenne pepper, which burns. And you don't really need an eye wash. You don't know where the eye wash, I don't know if you're talking about just using tap water, but sometimes depending on where you live, your tap water is actually well water. And we see all kinds uh, of corneal ulcers that occur with using well water in your eyes when you overwear contact lenses.
Mm-hmm.
So eye washes on occasion really aren't necessary. If you have a problem with your eyes, please go to your eye doctor. If we see something like you have dry eyes, we will prescribe the right kind of drops or medication for you. Now, of course, when you take a shower, of course, there's going to be some water getting in your eyes. You go swimming, things like that. But there is no need just to do certain kinds of eye washes unless you get something in your eye, a chemical in your eye.
Mm-hmm.
And please, again, do not hesitate. If you get something in your eye, go to your eye doctor, go to the emergency room, let them wash it out, because sometimes some of these particles can stay in your eye and cause all kinds of problems.
Wait a minute, Dr. Renee, you mean that what my mama used to do when she would hold my eye open and blow in it? That doesn't work?
No, I'm not gonna. Hey, I'm not gonna go against mom.
We're not
I'm
going
not gonna mess with
No,
mom.
We're not messing with mom.
I may need to call her after the show. Like, you was blowing in my eye all these years.
Here's another easy way to learn this. And Mr. Ellis, hold your ears. So y'all know what they used to say about the other area of the woman body about the douching.
Mm-hmm.
That's the same thing. We have natural flora inside our eyes to protect our eyes, to get rid of the germs and things of that nature. And what you will be doing if you're using the eye washes is you're doing the same thing. You're washing out the natural protective barriers that were already created for your eyes. So I don't recommend eye wash on a regular basis unless you are in a work environment that is like industrial type thing, to be able to do that. But with that, if you're in those type of work environments, I highly recommend safety eyewear, where you actually have that protection all over, and you won't have to worry about that stuff getting in your eyes.
Okay.
And if you feel that you need to use an eye wash on occasion, generally that means that maybe there's something wrong, and you should come, let us take a look, check it out, so we can get you on the pathway to having nice, comfortable eyes.
Yep.
Okay. Another question here: is ordering contacts online safe with a prescription?
Yes, if you do it right.
That
Making
means that,
sure you go to your eye doctor annually, get the renewal for that. Because a lot of times, well, why do I have to come annually when there is no change, or why do I have to come annually? I'm not really having any problems. If you go to your, again, here we go to the primary care physician, right? You go to your primary care physician for your checkups. If you're on particular medication, they have to give you that medication. It expires. So your script expires, and we are licensed, we are trained to have to go through each step by step to make sure that lens that we originally prescribed for you is still working, it's still fitting, it's doing what it's supposed to do. And I don't have a problem with you taking your prescription to the online industry, as long as you do it right.
okay.
And
So,
that's another reason. That is the reason why I became interested in ophthalmology, because I was amazed at the end of my second year in medical school, I could look inside the eye in its pristine condition, untouched, and actually get a picture of what's going on inside the human body. And then when I realized I had the opportunity to be able to restore vision via, be it with glasses, surgery, or medical, I thought that was just the greatest thing since sliced bread. So we're not minimizing contact lenses. We're not minimizing glasses, because that allows you to see. And that's what we want. Our
right.
goal is to get you to see. And I have so many tools in my armamentarium to be able to do that. And if you allow us to see you at least once a year,
Yeah.
Right.
we get a chance to see what's happening over time. And there may be something small that's okay, and we're like, okay, we can watch that. But over time, it's going to change, and we need to see things over time.
Yeah,
Yeah.
I agree.
And I think it just as that point to Dr. T, much like when people ask about when they're taking a dietary supplement
Mhm.
and it's not been approved by the FDA.
Mhm.
It's, oh, should I take this? Even some of those vitamins that you buy over the counter, they're not fully approved, and so you know, it may sound good when we're talking about eye washes. It may sound good, but the best place to get your nutrients is from your food, from the
Yes.
earth, from food that grows on the ground, and the best place to get your eye moisture is from your own body.
Yeah.
And so
Yeah.
we'll just leave it at that.
And
Uh,
just to touch a little bit on that, right? You was talking about the nutraceutical. We call those nutraceuticals. And
mhm,
so when you're talking about those nutraceuticals, you want to be sure again that you're talking to your eye care provider, because there are um like I think it's what I read study,
Areds.
IRID, IRID study, that we know which supplements will work for your macular degeneration and things of that nature. So again, what have we been saying all along? Come see us first before you
Yes.
take anything.
And let us know everything that we're doing. We're not here to judge you or anything like that. So just be honest, tell us what we're doing, because that can help us figure out what's going on. I remember years ago there was a weight loss supplement. I
Oh
won't
yes.
say the name. And that was causing people to have dilated pupils. And
Mm-hmm.
we were like, what's going on? But if you tell us what we're on, then we know these things. We know these interactions. We could say, okay, this is what's going on. And
right.
one thing I wanted to mention, and Dr. T has kind of touched on it because she sees family, she was mentioning. Please know your family history.
Story.
Mhm.
And if you have a family history of eye problems, even if you don't know what it is, if grandma went blind, or Aunt Susie went blind, or your parents went blind, you gotta tell us, because that could mean that you are at risk as well. And certain things travel in families, such as retinal detachment, certain kinds of corneal dystrophies. Of course, we know glaucoma. And people oftentimes, if I say they have a cataract, they'll say, "Oh, my mom had cataracts." Well, everybody is going to get a cataract if
Yes.
they stay on the planet long enough. One of those things
Mhm.
that happens over time.
If God
And
blesses you to live long enough, you're gonna get
that's right.
it.
And it's not necessarily a bad thing because we have so many ways of treating it now and so many things you can do. We will get into that a little later, I think. But we just want you to know to come and see us and don't be afraid. And we'll listen to you. And I like to work with my patients, you know, where they are. We can talk, we can fix it, and at least try to help because we're on your side.
Okay, so
Yep.
Dr. T, I know
Yep.
we got to get some rapid answers here as we're getting
Gotcha.
closer to the end of the hour.
I
All
saw
right,
that.
so talk to us about the makeup and the tarantulas that people are wearing
All
on.
right. Good. Listen.
Boy, we're really
Again,
getting down into it.
come on, let's go. This is my cup of tea. So listen, ladies. For number one, if you're doing mascara, make sure you're changing that mascara thing out every 2 to 3 months. If you're doing on the regular, once a month, right? Because it harbors bacteria. Number two, hair glue
Oh,
is not eyelash glue.
Mm.
Hair glue is not eyelash glue. I'm gonna say that one more time. Hair glue is not eyelash glue. So if a product is made for something else, it should not be going on your eyes, nowhere, shape, or form. Make sure that your eyelash technician is using the correct products. Go to good people, y'all. Come on. Go to good people. And the other part of that is, you know, and because if you're going to the right people, they're going to use the right product where you can actually clean your eyelids, where you don't get styes, where you don't get clogged glands. And I think I've posted a picture if you follow my feed a little bit, I'll post it every now and then. It's a young lady that got like 3 prickly eyelashes up there because she damaged her hairs,
Mhm.
her hair bed. So ladies, I know we want to look pretty, but yeah, can y'all use the right stuff on your eyes?
healthy is pretty. Healthy
Healthy
is
is pretty.
pretty.
Thank you, Dr. Renee. Healthy is pretty. And
So we
I
got
know
two
for me,
gems. We got two gems
I
here.
know for me, I didn't really get into the lashes, but I actually prefer the actual the magnet glue. That's what I use because I actually can
Mhm.
put it above my eyelash bed, and it's not actually clogging my pores, not the pores, but the
My
glands,
Bohemian glands.
my
Yes.
bulbian glands. Yep.
Got it.
And the other thing I will say is also, I don't know if people are still doing this, but getting your eyebrows waxed.
Mm.
You gotta, again, go when you get your eyebrows waxed, make sure they're using that just for your face. Because when they take that popsicle stick and they dip it and they put it on your eyebrows and then they pull the wax off and then they dip another popsicle stick, it may be a fresh one, but they touch your skin and they may, underarms, wherever people get waxed, that's going in that pot of wax. And they're
Yep.
not making a fresh pot of wax
Nope.
just for you. Poor
Yes,
Ellis, he looks
Lynn.
like he doesn't want to know.
Lynn said, okay. He's like, why did I do that? And the other part of that you touched on that too. You also with the microblading and all of that stuff.
Yeah.
Make sure. I know that in the midst of COVID, I was filling in for a colleague, and my first patient, 9 o'clock in the morning, she takes off her glasses and her eyes are red. I was like, whoa, wait a minute, what's going on? And she was telling me she was Spanish speaking, really difficult to understand. But I was trying to the little Spanish that I do know was trying to get to her. But it just so happened that I really said, you know what, this is an allergic reaction to latex.
Mm.
Mm.
So
Yes.
it wasn't an eye infection, is because I asked her, I was like, I just happened to ask her, I said, do you use gloves? She said, no, allergia. And I was like, oh, no, you have a latex allergy. Eyelash glue has latex, and some of the waxing also has latex in it. So be
Mm.
careful of what you're doing.
Well, y'all are changing lives right now because they were like, hey, they changing their mascara tip right now.
That's
So,
fantastic,
all
Janine.
right. So here's the last two questions. We can get you out of here. Number one, because and again, I'm having a call to my mama after the show, so I'm just already talking about blowing in my eyes. I'm talking about that, and this other thing I'm talking about. She made me eat carrots as a kid. Are carrots good for your eyes, or is that a wives' tale for moms to tell their kids to eat carrots?
Listen to your mom. Eat the rainbow. Yes, indeed.
Lutein.
Yes. All the colors, the carrots, the greens, the apples, all of that, all the different colors are good for you. Listen to your mom, please.
Okay.
Yes,
All
They
right.
please
have
listen to mama.
antioxidants help protect your eyes. And one other thing, we've given you a lot of a lot of don'ts and things that aren't so much fun. I'm going to give you one fun tip. Sunglasses are good.
Yes.
Sunglasses do help protect your eyes. They help to prevent pterygiums. You know, that's a white growth that you see sometimes growing up across people's eye. Yeah, cool daddy
Yeah,
yo.
come on.
Cool daddy yo. There he is. Yes. Sunglasses are good. They help to slow down the progression of cataracts and even certain skin cancers. So I've seen all of that on the skin around the eyes.
Any
So
specific type of sunglasses, or like that I've got a pair that are polarized for when I go play golf. I've
Yes.
seen the UV protection. Are there any type of sunglasses that we should be looking for, or the type of the lenses?
Well, you should make sure that, again, see us first. Ask all the questions. What are you using them for? Like you said, golf, right? You have the polarized lenses. A lot of fishermen use it. They use it in military. Again, golf, it actually protects your eyes a little bit more, and and it's not that tint where it's gonna darken everything that you see. I'm a fan of transitions. Transitions have really improved over the years. They even have nice funky colors now, pink, gold, and things of that nature. So the most important thing is you can do UVA, UVB, UVA, UVB. Um, Coatings put on there. You
Mhm.
also have your anti-glare coatings that you can put on there as well. So all of the above, you named it, Ellis, that with the eyewear.
and it's important to, I mean, you can pick up the drugstore glasses in a pinch or something, but really, you may have astigmatism, you may have a refractive error that really can be corrected and allow you to see your best. Even like Dr. T said, even with the reading glasses, we
Mm.
can see that. And we notice eye strain because people are still straining, but because they haven't gone to see their eye doctor, they're straining even though they have a pair of glasses. So I would like to say, don't discount your health and discount yourself. You
Yeah.
know, you can say, I'm not going to go out to eat one day a month and go and get an excellent eye exam.
Yeah,
Yeah.
that's it.
All right.
And,
Final.
and one last thing,
Yeah.
and the earlier, how do we get the kids? Get them wearing glasses, get them wearing sunglasses, get them wearing their own glasses, and let them pick them out when they're going to get their eyes examined for school. Let them pick out their own eyewear, right? So they'll feel more comfortable with wearing them and like what they picked out. So the earlier they get it, the more they're getting used to putting them on their face.
Okay. Final question.
And I'd also just like to really thank CVEA, Children's Vision Equity Alliance. I would like to thank the National Eye Institute and the American Academy of Ophthalmology, American Academy of Pediatric Ophthalmology. Please, we are so appreciative. And we have there are links. I don't know, Ellis, if you can put up links to these organizations, but Prevent Blindness, they're the reasons why we're here. And that's what we're in. That's what we do, why we do what we do. We want to prevent blindness. And Children's Visually Equity Alliance allows us really to focus on minority health.
Yeah, I believe it's preventblindness.org. You can always, there's a number of resources. If you go to the National Eye Institute website, you can also learn about, there are resources available to people to cover eye exams and other eye procedures. And so don't feel like you're out here alone. So go to these sites, go to the National Eye Institute site, go to the preventblindness.org site, go to the CVA site. There are a number of sites, and we're going to have some articles and things like that with these links included on blackdoctor.org, so you can get all the information. But please, please, please do not go out here flying blind. There's another bad joke as we're getting out of the door. Don't fly blind when it comes to this situation. There are resources available to you, information, financial resources available to you. There's something that can help you, because understand this, there are two things that you're going to really, really miss if it's not working properly. One is your air. So if you have breathing problems, and number two is your eyesight. And so everything will stop if those two things are not in tip-top order. You have the most ability to protect your eyes than these two wonderful doctors on this call today, on this program today. They can do the best job they can, but you got to come in and see them. And then you got to do what you need to do outside of their office in order to protect your vision. So we talked about some of those things. Eyewashes, get that out. Number two, eat the right foods. Eat healthy food. Eat the rainbow. Eat those healthy. Your mama said eat them carrots, okay? Eat everything you're supposed to eat that you're supposed to eat. Stop smoking. We didn't even talk about smoking. If you're smoking, you got to stop smoking. Got to stop that. It's both inside and outside. You got to stop smoking if you're smoking. There are a number of things that you have control over before you even get to see Dr. Renee and Dr. T. So you can control those things and then let them give you a good eye exam and say, hey, here's what you need to do. And then if you need some help, if you need some correction, lenses, whether it's contacts, we didn't even talk about LASIK. So we need to have y'all come back and just talk about LASIK and all the situations that comes with LASIK surgery. But all of that, control what you can control, be your own best health advocate, do what you need to do, get that eye exam. Once you hit age 40, I heard age 40, you see a regular eye exam, take your kids to go see the 3 O's that we talked about at the beginning of the show. All three, got to go see them. Yes, Dr. Renee.
Before we close, I know we talked about finances, and the American Academy of Ophthalmology has something called iSmart and Eye Care America. So if you go to the American Academy of Ophthalmology, you can sign up for Eye Care America. You can get a free exam. Other organizations have ways that you can get even free surgery. So we want you to see. That is our whole goal, is for you to see and to prevent blindness. And Dr. T and I, we are on your team.
That's right.
Absolutely.
And the other part of that is there's also I don't know about in your area. I know if anybody is watching in the Philadelphia area, there are other programs where again, I'm affiliated with Eagles Eye Mobile. We actually go into your school, so make sure your nurses know about the programs that come in. Will's Eye, we go into your schools for the kids. So just make sure that the nurses kind of touch base so that if you're working 9 to 5 all the way till Sunday, right? We will come into your school and examine the kids there. So you don't have to worry about making that appointment. There are so many resources out here for you all. Y'all just don't know. You may just have to just reach out, like I said, to the blackdoctors.org, and
Yes.
we'll get y'all straight.
And I
we
think, Ellis, you can put up these links and we can make
Yeah, I
sure you
couldn't
have
I
this.
couldn't get in on this side. So yeah.
Yeah, we could definitely put those up. We'll have we're going to re-air this tomorrow, and then we're going to put the links in the comment section so people can click on those comments and go directly to those things. And then we're also going to write an article with this program as part of that article, and the article will have all those links as well. And again, this is not the last program that we're going to be doing here on a healthy vision, but this kicked it off. So we have to make sure that we're going to follow this up. Really, thank everybody that stayed with us and just asked some really, really wonderful questions. Starlet and Maurice and Agnes, I see you jumping in later on, and Kim and everybody that asked some really, really wonderful questions. Lynn, I've got to give you a shout out to both Lynn's. There's two Lynn's in there. That were asking some questions and really just staying with us this evening, because understanding your vision is it's so important, and you don't think about it until it's gone or it's compromised. And that's not the way we should be thinking about our vision. We have to protect it so we don't get into a situation where it starts to fade and it gets to a point where Dr. Renee can say, we can prolong it, but it's gone, right? Because you've waited too long. And that's a reality that can happen if you don't get your eyes examined on a regular basis. So do what you need to do. It is that time. So after this, get online, if it's your first eye appointment, make it today. If it's not, then you need to do a checkup, get it done now. So it doesn't bother you in the future. You won't have that glaucoma. So thank you, Janine, so much for that. We're going to leave with this wonderful, wonderful comment for the both of you. This has been a wonderful program. So much energy and so much information. Thank you both for being here. And thank you all for joining us here on blackdoctor.org.